Today on the show, we're going to have a full-length conversation about measles, which is something we shouldn't be having conversations about because the disease was technically eliminated in 2000. It's back. We're probably going to lose our elimination status and lose a lot of other things instead. And we're going to talk a little bit about why that is, what the communication problem is that's making it so hard to get people to understand the easy way to avoid measles.
It's a big sickness, mighty fine with me. I've been already through this again and again now. We're going through Kleenex. It's nothing new. I worry slightly with an aching. They go low, you go high, you bring more than your own supply. That dirty game you don't play, that shit's contagious. You stay away. That shit's contagious. You stay away.
All right, so we are going to be talking about measles today, which are very contagious, as per the song, about as contagious as anything gets. We are going to talk about it as a medical and epidemiological problem. We're also going to talk about it as a communication problem. I think we may have reached a point where dealing with something like this, like measles outbreaks, it's almost 50% medicine and 50% communication. And the communication part almost seems to be where we're lagging behind. We've got the medical science, but maybe not the way to get it into people's heads. We'll talk about all of that. We're going to begin with someone who's been on the show before a bunch of times, Dr. Jennifer Nuzzo. Dr. Jennifer Nuzzo is inaugural director of the Pandemic Center at the Brown School of Public Health and a professor of epidemiology. Welcome back to the show.
Thank you. Thanks so much for having me. I appreciate it.
So we're having the kind of measles outbreak that we don't want to have in this country. It looks like it's probably going to be the largest one in a year, once it's had a full year since measles was nominally eliminated back in 2000. So maybe just begin Measles 101, remind people what this disease is.
Yeah, so I really hate that I have to talk about measles because it's a disease that we shouldn't have to be talking about. In 2000, measles was declared eliminated from the United States, meaning that we would have cases here and there, but it was usually rare and in people who traveled abroad to places where they hadn't successfully been able to control measles. But unfortunately, as you said, the United States is in, really one of the worst outbreaks of measles we have had in 25 years since measles was declared eliminated. It's a bad disease. It's a respiratory disease, first and foremost. It's one of the most contagious diseases we know. It's a disease that if you get it, about, anywhere from 12 to 20% of people who get it wind up in the hospital. Those who survive can have long-term health effects, some of which can happen, many, many, many years later. So it's very much a disease you don't want to get. The United States in the last year has already seen 3 deaths from measles, which makes it the deadliest outbreak of measles we have seen since elimination. And it's just one of those diseases that we have been fortunate to been able to control because of the existence of safe and effective vaccines that are extraordinarily good at protecting people. And yet here we are yet again having to think about this disease because not enough people are convinced of the benefits of the vaccines.
Yeah, one of the interesting, if that's the right word, phenomena here is you have a lot of doctors around the country who have, particularly if they're reasonably young doctors, never treated a measles patient in their lives. That would be kind of probably the rule rather than the exception. And suddenly they're seeing this. But we also have a lot of people who are communicators. about this, with or without qualifications, who also either have never seen measles or don't remember it correctly. To me, and this is another thing along with measles that you probably don't want to talk about, but to me, the most egregious example lately has been Joe Rogan, simply because he's so influential. He's the most listened to podcast in America. This is part of a conversation he had just a little while back. Here we go.
Measles included, speaking of the current thing,
which
that's
is
a controversy.
an infection that everyone got when I was a kid. And what happened was you'd get sick for a few days and then you'd be immune for life.
Yep.
So, Jennifer, Joe Rogan was born in 1967, which means that he was born into a pretty much fully vaccinated American population. The idea that he actually has any clear memories of what it's like to see people with full presentations of measles is an illusion that apparently exists somewhere in his mind.
Yeah, no, it is an illusion. I mean, if he had been born in the early 50s, I would believe that story. I am happy to say I am younger than Joe Rogan, but I have family members who were born around the same time, and none of us have seen measles be regularly transmitted in our lifetime. Our parents got it, but we didn't. So I think that's I don't know what disease he's thinking about, but it's likely not measles.
Probably chicken pox. But yeah, I mean, I am older than both of you, and I think one of the really important numbers that you said here earlier in the show is the percentage of people who wind up in the hospital. These are mostly children. They may not die. They may not get encephalitis. They may not get pneumonia, although the risk of pneumonia is pretty high here. I think it's the number one measles-related cause of death. They may not get any of these pretty severe complications that we talk about, but they're in the hospital because they're so freaking sick that they can't be treated any way else. And I think that's kind of what's missing from what people like Rogan say.
Yeah, and measles is really a terrible disease. I mean, one rare, and I have to admit this is rare, but one rare, really terrifying complication is that you can contract measles as a young child and still be at risk of dying from that infection as many as 10 years later. It's a rare condition called that sometimes happen, although there was recently a death attributed to this. A child had contracted measles when that child was too young to be vaccinated, and then years later died from that earlier infection. And I think about that as a parent and think about how horrible it is when your children are sick and you're up late with them at night. And if they are fortunate enough, not to be in the hospital, you're lucky, but then to have to worry like later, 10 years later, that earlier infection could cause harm. I mean, that's just a really, really terrifying situation. So measles is terrible. I'm so glad that we have a safe and effective vaccine that's great at preventing those harms. And it just kills me to think about all the people who are unnecessarily losing their lives or going through that when they just simply don't have to.
Yeah, and to that point, and then we're going to get to the vaccine in just a second, but to that point, and you might have mentioned that when you were listing some of the stuff earlier, but this whole mounting evidence that measles can essentially give your antibodies amnesia, that the immune system that you have that is ready to react, not just to measles, but to other kinds of infectious diseases, can lose its effectiveness, lose its ability to recognize pathogens and defeat them because of some, I don't even know if we quite understand the mechanics of it.
Yeah, I mean, it can help, depopulate some of your prior immunity. So, all of the sicknesses that you went through that your body has learned from, your body may forget about. And then it's like, experiencing those illnesses for the first time again, which, is really not taking advantage of the benefits of having an immune system. So, that's it's just a really troubling to think of these sort of long-term health impacts that, shouldn't have to be something that people worry about.
So we've got this also interesting situation where, polling indicates that people still support the idea of vaccinating against measles, support the MMR vaccine, which is the key tool in doing this. But part of the problem, I think, is that there is actually a surprisingly big difference between 95% vaccination in a population and 90% or 88%. Those might, in other situations, those might seem like kind of similar numbers, except they're really not, right? There's kind of a cliff, or maybe the opposite of a cliff that happens around 95.
Yeah, so The 95% isn't a magic number. It is a calculation based on if someone has measles, how likely are they to spread it? And how many people in a population have to be vaccinated such that the likelihood that they would encounter somebody who's susceptible to the infection is near zero. So that's where that 95% comes from. Anything below that, you start increasing the likelihood that they're going to encounter somebody who's susceptible. The challenge is that we as a country now have a vaccination coverage that is below even 90%. It's been falling, particularly since 2020. But in many communities, it's actually much lower than that. In many schools, it is actually much lower than that. So in West Texas, where the outbreak that the US is dealing with now likely started more than a year ago, if you look at the MMR coverage, where that's the vaccine that we use to protect against measles, if you look at the MMR coverage for entering kindergartners in some of the schools in West Texas, in some cases it's 14%. And it really matters who your kids are going to see. That probably matters more what's happening in their school than what's happening across the state. So we have these persistent pockets of like exquisite vulnerability to measles, and because this virus is so incredibly contagious, when it finds its way into these communities, it just causes these explosive outbreaks. And that's really what we're seeing now.
Yeah. And, there's also, I heard somebody say there's like 1,000 different reasons why people don't get vaccinated. It's not just one or two. So one of the really bad outbreaks probably the worst outbreak we're having right now is South Carolina. That some of that may have started in a charter school that I believe had Ukrainian and other Slavic students in there. They had about a 21% vaccination rate. A lot of that seemed to be maybe kind of multi-generational paranoia about how public health was in the Soviet Union and for Soviet satellites. So you've got a thing like that where if there's a 21% or a 14%, as you said in Texas, vaccination rate, that can be as important as I think you just said, as the overall state or national rate, and it can have a multiplier effect once it gets started.
Yeah, absolutely. I mean, what we're seeing is that these diseases don't stay put, and they spread into other states. So what we saw in West Texas spread into surrounding states. What happened in South Carolina spread to North Carolina. There are now cases in California that were likely linked to them. So, and even in Texas, which had stopped reporting measles cases because they didn't see any more measles cases. I don't want to say they controlled the outbreak because it's not clear to me that it was controlled in so much as it may have just burned itself out in the particular kind of social group. They're seeing cases again. So what this is setting us up for is a future in which we just keep having these recurring measles outbreaks throughout the country. Not only is that like perilous to our health, but it is incredibly costly. Every single case of measles will cost, public health authorities and our society because of the lost productivity and healthcare costs, in addition to the cost of actually trying to find that case and responding to it. It's tens of thousands of dollars per case. And so, in the last 3 months, we've had, nearly 2,000 cases. So just thinking about how costly this recurring measles outbreak situation is, it's really unfortunate.
We should just spend a minute or two also on our ability to respond, which has been, in the lap of public health officials in states and municipalities, but also the CDC. The CDC has now gone, I think, more than 200 days without a permanent director. Just contrast that with how fast we went from Kristi Noem to Mark Wayne Mullins. So Dr. Jay Bhattacharya is doing double duty, running the CDC as acting director and running the NIH. And in South Carolina, there's a kind of slow burn early in an outbreak, and then there's a jump up. The CDC got there recently, 5 months into, arguably, an outbreak that began in the fall. And I'm just wondering about all that. I don't think our CDC is the CDC we used to have. And I wonder about its ability to get in there. I mean, if you vaccinate a lot of people early during an outbreak, you can stave it off. But I don't know that happened this time.
Yeah, well, the reason why one of the reasons why we worry about measles, aside from the fact that it's a deadly disease that we shouldn't be experiencing outbreaks of, is just that when you see measles outbreaks start to happen regularly, it's a very bad warning for how good we are at just detecting and responding and stopping deadly disease threats. It's a proxy indicator because the steps that you need to take to respond to measles are the same that you would need for a pandemic or a biological attack. So a range of disease scenarios. If you want to know if a country's good at stopping disease, look at whether or not they have measles. And if they do, you know that that country needs a lot of help. So clearly something is broken here. I will agree that I don't think the situation at CDC is ideal. You can't run the CDC as a part-time job. That is very much a full-time job. It's a nationally important job. But it's not just CDC, it's also HHS. And, in my view, one of the biggest limitations is that we have missed opportunities to talk about how vaccine is the only sure way to protect yourself against vaccine. We wasted a lot of time as a country having a conversation a year ago because of comments made by the Secretary of Health and Human Services, Robert F. Kennedy, as to whether there are alternative therapies that could help protect people against treatment. The only way to protect yourself truly against measles is to be vaccinated. And that should have been the clear message from the beginning. And the fact that it wasn't, the fact that we didn't make a full court press to say, okay, where are the communities in which measles vaccination is below 95% and work and do the very hard work of community engagement and employing trusted messengers and all those stepwise components of making sure that people understand the benefits and safety of vaccines as the only true way to protect ourselves against measles. And I think we've wasted a lot of time, and it doesn't bode well for what we as a country can do to protect ourselves against a range of other disease threats.
Okay, I'm going to drag you a little bit out of your area of specialization and into the realm of a little bit of politics, although it's hard to talk about all this stuff without talking about politics. I'm wondering if you see any signs that are, or any tea leaves that are cause for encouragement. I'm thinking of the fact that Dr. Mehmet Oz, who runs CMS, and the aforementioned Dr. Bhattacharya recently spoke publicly and pretty emphatically in favor of getting vaccinated. Dr. Casey Means, who's going through confirmation process for Surgeon General, was kind of wishy-washy the first time around talking about vaccination. And then her second time out, suddenly she'd found the words for really encouraging people to get their kids vaccinated and to get vaccinated. I would even say, when the Moderna flu vaccine was initially rejected by the FDA for consideration and then resubmitted and was accepted, Dr. Vinay Prasad then resigned from the FDA right after that. You sort of see signs that maybe somebody, maybe closer to the power core of the White House, is saying this stuff doesn't really play very well with the public overall, kids getting sick and stuff like that. But your thoughts?
Yeah, well, first of all, it's really important to point out that the American people, and you said this, but I'm going to repeat it because I want people to really remember this. The American people are by and large overwhelmingly supportive of childhood immunizations, MMR vaccination in particular, so the vaccine that we use to prevent measles. Poll after poll after poll showed that the American people not only think that it is important to vaccinate your children against measles and other routine childhood diseases. It's important to do that to not only protect your children, it's important to do that to protect other people in society. So the vast majority of Americans believe in vaccines and think it is a parent's duty to vaccinate our children. That is even true in places like Florida, where there has been a political effort to try to remove school-based vaccine requirements. So, you have to vaccinate your kids in order to send them to public school. Those political moves are being done at odds with what the American people say they believe and they want. There has also reportedly, and I'm not a pollster, but there has also reportedly been political polls looking at the politics of taking an anti-vax stance as political leaders. And what apparently those polls are showing is that being anti-vax does not make for good politics. And there is apparently a message being sent saying if you are trying to, be out in front by saying you're not in favor of vaccines, you may lose an election. And so that could be why we're seeing a shift in messaging coming from federal health leaders. I will just say I am very glad to see that Jay Bhattacharya and Mehmet Oz both said that get vaccinated against measles. We need more of that. I wish we had it a year ago, but I'm glad that it's happening now. We need more of that. What people say during confirmation hearings, I think Secretary Kennedy said a lot of things in his confirmation hearings that have since turned out to not be what he has done. And so I just worry about how truthful people are in that setting. But I will say absolutely that MMR vaccine is the only way to protect yourself truly against measles. And it is really important that our political leaders and our federal health officials that are appointed by our political leaders say that and only that.
So one last thing. So the Pan American Health Organization pushed back a decision on elimination of reconsideration of the United States and Mexico's status as measles elimination countries, and they pushed it into November. A cynical person, which you definitely are not, but I might be, a cynical person might wonder whether that has anything to do, particularly based on everything you just said, it might have something to do with that coming after the election. I'm not going to ask you about that, but I am going to ask you, I mean, we'll probably lose our elimination status whenever they have a hearing about it. We don't qualify anymore. What will that mean? Will it mean anything? Is it just kind of a talking point, or see what that amounts to?
Yeah. So I think by all measures that matter, we have lost our measles elimination. Measles has reestablished itself in the United States. Measles elimination is determined by whether you have continued transmission of measles for 12 months. And we have had outbreaks in the United States, domestic outbreaks, domestic transmission of measles that has gone on for 12 months. The 12-month mark was in January, and we still have measles. In fact, since January, we have had nearly as many cases of measles in the 3 months that have elapsed as we had the entire year before, which was the largest measles year since we eliminated measles 25 years ago. So by every metric that matters, measles is here transmitting in the United States, and we are bearing the costs of that, all of the costs of that. Whether we will officially lose our status, I think there is a question mark, in part because some people are trying to make the argument that, well, you know, these cases in South Carolina, they're actually in a different demographic group than the cases that occurred in West Texas more than a year ago. And we don't have concrete evidence linking all of these cases to each other in one chain, one, transmission chain. And that if you look at the genetic, analysis of the different viruses, they might have come from different sources. Listen, to me, that's a useless argument to make. You should be looking at the genetic analysis of the virus because it might point to different places that could offer opportunities to control the virus. We should better understand transmission dynamics. But by all measures that matter, the United States is no longer a country that has eliminated measles. And whether or not that decision will be made in November when PAHO meets, I don't think it matters for the American people. The only thing that matters is now we have to fear measles again. It is a little bit weird. The organization that was going to review whether we lose measles elimination status was supposed to meet in April. It's got postponed to November. Some people noted that it got postponed to after the midterm elections. That was supposedly because the United States was wanting more time to gather genomic evidence that could potentially delink cases to make the argument that, well, it hasn't been continuous in terms of a single transmission chain. Anyway, I think that these are details without distinction, and really the only thing that matters is that we now have measles and we're doing a very poor job at controlling it. Because we have had more measles in the last 3 months than we, had in the last, nearly in the last 25 years. And that is really a problem.
So we're sorry to end this interview on such a down note, but on the positive note, Dr. Jennifer Nuzzo is one of the people trying to bring light into this conversation, inaugural director of the Pandemic Center at Brown School of Public Health and a professor of epidemiology. Thanks for joining us again.
Thanks for having me. I appreciate it.
We'll take a little break. We're going to come back. We're going to talk about that communication job and a very unusual podcast taking a new approach to it.
Oh, the cat's got the measles and the dog's got the whooping cough, doggone. Oh, the cat's got the measles and the dog's got the whooping cough. Doggone a man, let a woman be his boss, doggone my time.
that's the way I like it. My garden's a secret compartment, and that's the way I like it, and that's the way I like it. Your body's a dream that turns violent, and that's the way I like it, and that's the way I like it. The winter is long in the city, and that's the way I like it. So please, baby, please, open your heart, catch my disease.
Well, maybe not some of the diseases we're talking about today. But yes, I promised you some more perspective on what I think is almost 50% of the battle these days, which is effective communication about public health questions, and epidemiology, and vaccination. And there is one group of people doing it very, very well. Brenda Adhikari joins us, award-winning executive producer, showrunner, and journalist, co-host of the Why Should I Trust You podcast. This is something that I've started listening to. And so, Brenda, first of all, I think one of the things that's happening on your podcast that should be easy, should be obvious to everybody, but you seem to be just about the only people doing it, is having both sides of this question get together and talk, ideally in a pretty civil and mutually accepting and respecting format. See, first of all, for people who haven't heard the podcast, describe your mission statement.
Yeah, thanks for having me. That was a great song, by the way. Whatever it is, I want to ask you guys about it.
It's Ben Lee.
Okay, got it. I'm gonna write that down. So yeah, our podcast, Why Should I Trust You? We've been around for about a year, and we thought, it's time for us to look at this conundrum we're having as a society, where it appears that many people don't trust institutional medicine or science or public health, or quite frankly, we don't really trust each other very much. So we wanted to launch a show at the same time that, Trump won the election and Kennedy had become the head of HHS. We thought that we really want to track this conversation around mistrust for institutional health. And what better way to do that than to engage with the very people who mistrust health? So rather than kind of talk around it and talk about, and just have experts on to sort of talk about why there's mistrust, we just wanted to go straight to the sources. So we moderate conversations between many people who mistrust institutional medicine, and many of them tend to be from the Make America Healthy Again movement, but of course not, as well as we found out. And we've done about 20 of these conversations so far in the last hours, and they're really something, I think.
They are. And I think there's also these kind of facts on the ground that are a little bit different. Even having a conversation with someone as esteemed as someone who I respect as much as Jennifer Nuzzo, some of the conversations you have are kind of about care as it's being administered and delivered, parents as they are making decisions. And one thing that became clear, and I think somebody said it on the March 12th podcast you did about measles, is there are 1,000 reasons why people don't get vaccinated or don't trust conventional ideas of public health. Not one. I think we have this idea that it's some conservative Christian family, or maybe alternatively some new age woo-woo mom drinking kombucha or something. And a lot of these stereotypes get in the way of having effective communication. Maybe you could say more about that.
Yeah, I think that there's a lot that we still need to learn about who the unvaccinated are. Once upon a time, it was, healthy and wealthy. It tended to be people who were, highly educated from high income places that sort of had the, the luxury of sort of eschewing conventional medicine. But these days, there's evidence to suggest that it's just the opposite that's happening, that in fact, it's lower income folks from lower education status who are saying no to vaccines. And so I really would just beseech pollsters and researchers out there, like, we need better data on this. And it's something I said on that episode, Colin, that you referred to. Look, there's all kinds of reasons that people say that they don't want to do this. As much as I know your former guest so eloquently talked about how popular vaccines are, and she's 100% correct. The other kind of data point that's really interesting to me is that while people may be supportive of vaccines, an increasing number of people are questioning their safety, and that both things can actually that people can hold both of those data points in their mind. So and where the vaccine hesitant are, like, yes, it's very prominent amongst certain religious and ethnic enclaves in this country, but also younger parents are growing more and more concerned. The Gen Z parents tend to be more vaccine hesitant than older generations. So again, the devil is in the details here, that while there may be a broader support, I think it's really crucial for us as a society to look at those pockets of mistrust, because it doesn't take much to create an outbreak in this country.
I think another thing that kind of emerges to me from your podcast is that it's very hard to communicate with people if they don't recognize who you are, they can't identify themselves with who you are, that you don't necessarily maybe share some of their other values or enthusiasms. So, for some esteemed virologist to come on television or on a podcast and throw out a lot of very true scientific facts may not be as appropriate as hearing them from somebody who maybe talks a little bit like the listener talks, or likes the same sports team that the listener likes, or that kind of thing, that people recognize each other a little bit more readily.
That's exactly what we've learned through the show. We spend probably the first hour, and like I said, these conversations go on sometimes for 2 or 3 hours. We don't air all of it because that's a lot, but we do air most of it. I'd say, we've had some episodes go on for 2 hours, but the first thing that we do on the show is we just talk. We just introduce ourselves and we say where we're from and talk a little bit about ourselves. And in that process, we learn things like, somebody who's like a big Kennedy supporter or a Maha supporter might say, I'm from, and this is not even a hypothetical, this is what happened, that somebody, I grew up in Ohio, in a particular town that was the epicenter of the opioid outbreak in Ohio. And then it turns out that somebody in public health is like, you know what, I also have a sister who suffered from opioid abuse. And then the two of them sort of have this connection. And, it then leads to the ability to have, at least in my experience, have those tougher conversations, because there's this like node of trust that's been created. So I think it's really important for us, that we've learned on the show, to try to align around just common values, common cultural reference points, things like that, so that we can even build a pathway to be able to have those tougher conversations.
An awful lot of the conversation, I guess I would put quotes around that word, that takes place these days happens on social media. I think there's some questions about whether that counts as a conversation. And it often happens in a way that the information is disseminated by people who maybe don't entirely know what they're talking about, but heard it from another social media account, that heard it from, or read it from another social media account. I saw this here in Connecticut, where we had a couple of vaccine-related bills in our legislature this year. And I saw the people attacking those bills on social media. And most of them didn't know what the bill said and were mischaracterizing it. I don't think they were doing it for cynical reasons. I think they'd heard it from somebody else they trusted, which kind of gets back to one of the words in the title of your show, that one of the problems with trust is if you trust the wrong people, you're going to wind up passing along and making viral, so to speak, pieces of information that are not accurate. But I'd love your thoughts on that too.
Yeah, it's a great point. It's one we encounter a lot, which is, that sort of, that fault line between there's terrible information out there that's being amplified by bad faith actors. And then, you've got good faith actors who either don't know how to access people that they want to be able to influence in some way. But I think that's just the wrong conversation, if I'm being honest. I think that it's really important to kind of rewind and go way further back in the chronology of this. That if you're trying to get someone who's having an argument on Twitter about a bill in a Connecticut state house, like, that's not the right entry point to try to talk to somebody about vaccines. Like, they're gone by then. To me, the way more impactful thing to do, like, you can't respond to about vaccines in the middle of an outbreak. Like, that's not the time to do it. The time, and unfortunately, we don't always have the luxury. I totally understand that. But to me, it's really important and crucial to be able to create community and create shared experiences so that you even have a shot at, like, speaking with someone that you may have any hope of maybe trying to impact. And I don't do this, Colin, to persuade people. I want to make that really clear. My job isn't to change people's minds. My job is to create an environment that is a safe place for people to come and talk with, and then they can figure out what they want to do with that. But I view that as I want to create a trustworthy environment.
Yeah, I think your job is to get people to have a good conversation instead of a bad conversation, and you're doing it really well. But one thing that we keep kind of butting up against as we talk about this, Brenda, is that a lot of times the conversation is happening between people, at least one of whom, if not both of whom, are in what the dog whisperer Cesar Millan used to call the red zone. I mean, they're already snarling and barking and ready to go at each other. And I wonder about that. I mean, it seems like with this Connecticut bill, I was sort of asking some of the proponents of the bill why they weren't more out front. Why weren't they being quoted a little bit more? And one thing that came back was, some of the people who had been advocates for kind of the conventional ideas about public health and vaccination got a lot of threats and harassment. And I'm sure some version of that also happens to the MAHA side of it, that people, not only are they exercised about this and heated about it, but they're also a little bit scared about what's going to happen to them if they do express their feelings. And so you're trying somehow or other to get that clock rewound enough so that people are starting from a better place. But how do you do that?
How do you sort of rewind that clock?
Yeah, how do you get them to a place where they're a little bit more able to hear and listen and understand?
It's not easy. It takes a lot of time, even before we have the conversations, to have those, in the industry, you call them pre-interviews. But for us, it's really like you have relationship building sessions where it's not on camera, it's not on mic, where you're just talking to people and they want to know, well, am I going to come on the show? And is that person just going to make me feel bad for not taking the vaccine? Or am I going to come on the show and they're going to call me like an authoritarian dictator during the pandemic? Like, what is this? And so part of it is we set some ground rules. Like, I'm not looking for a cage fight. I'm not looking for some UFC match here. I always say it's like all of you are invited to my house for dinner. We just ordered some pizzas. We just picked up a few 6-packs of beer. We're going to pop a squat on my rug and we're going to talk. And sometimes dinner parties at my house used to get a little messy, but at the end of the day, we're still going to leave. One of us may want to grab a beer with someone else. And so I know it makes it sound kind of facetious, but I really do mean it when I say that you have to sort of create the right environment for these conversations to thrive. Because unfortunately, social media, as you know, and cable news, those environments are created for conflict. They are created to maximize clicks and conflict. And we try to kind of defang that. It's not to say that we don't have conflict. If you've listened to our episode, we have conflict. But we figure out a way to keep the conversation going. And some conversations are better than others, quite frankly.
We're running out of time here. I do want to say, I would really urge people to listen to that measles episode because I thought I knew the subject pretty well. I learned a whole bunch of things, or just things I hadn't thought about. For example, I think one of the doctors said, measles is probably drastically underreported, partly because if you report it, there are consequences, immediately consequences maybe for your kid or whatever, but also contact tracing, which means people get called up. There are all kinds of things that sort of kick in that make it an actual disincentive to report or even investigate a question about whether somebody in your family has measles. I hadn't really thought about it that way, that we've created a disincentive structure for people to be honest about what's going on in the health of their families. But I don't exactly have a question, but it does seem as though people on your show talk about stuff differently than they do on conventional talk shows.
Oh, man, I love to hear that. I love that episode, too. I learned so much. And one of the things I learned that maybe as a closing thought is both the West Texas health director, which is, again, where the outbreak was last year, and then the one in Spartanburg, South Carolina, they both said that they were really missing community level leaders to sort of interface between like big public health and the community. And some of that is because of funding cuts. And some of that is because that's also, I think, a kind of conflict that is occurring inside public health sometimes too, about how much they actually amplify community-led interventions. And And I think that's something that's really worthwhile to look at, that if there had been somebody who could really have been an interlocutor between the Mennonite community and the Lubbock County Health Department, could there have been a slightly different outcome there? I learned that from that episode.
Great point. Brenda Adhikari, thank you so much for your time today. Award-winning executive producer, showrunner, and journalist, co-host of, and you should be listening to this if you're interested enough in this topic to be listening to this episode of this show, you should be listening to Why Should I Trust You, the podcast. We're going to take a break. We're going to come back. We're going to tell you about another kind of communication.
So vaccination all across the nation, keep you from catching monkeypox. When you get the notion, Tower's got the potion, you might begin to set yourself in motion. I'm talking about so vaccination. So vaccination.
Some quick thanks here. First to the maestro, Dylan Reyes, our technical producer. Lily Tyson, Quality Entertainment Productions, made the show possible. So thanks to them, whoever they are. I've never been entirely clear who they are. But we are going to talk about communication one more time on this show. This time, Terry Mills is joining us, retired nurse educator, grandmother, and board member and vice president of media for grandparents for vaccines. Maybe you don't know about this organization, but what they're doing is really interesting. And it goes back to the Joe Rogan clip I played at the top of the show where Rogan said, when we were kids, we got measles and we were sick for a few days and then we were immune for life, which is, and he's born in 1967, so he never saw people get measles. Terry Mills, you and I come from generations that saw people get measles. I went to school with a polio survivor, and that's kind of what you're doing, right? Sort of reintroducing the stories from your past, my past, and the past of the baby boom generation. Say a little bit more about that.
Sure. Thanks, Colin, for the opportunity to share Grandparents for Vaccines with your audience today. So grandparents formed because we saw this, just like Dr. Nuzzo said earlier in the show, we're seeing this rise in what we know now are preventable conditions that when we were kids, we had these diseases and it wasn't just a simple cold. These were really awful, awful diseases and we remember them. And we also have seen just the vaccination rates fall around the country. So concerned grandparents were upset because we know that our grandkids are at risk. And there's no greater love than a grandparent has for their grandchild. And since there's 67 million of us and we're mostly respected in our families and we are the trusted messengers, we want to speak up and use our lived experiences to share those memories so that our kids really know firsthand what these diseases were like.
Let's hear a little bit what that sounds like. This is going to be Therese. Therese is from Grandparents for Vaccines. She's from Oregon. She's telling the story of her sister, Nancy. C1, please.
Nancy, when she was 4 years old, contracted measles. Back in those days, they didn't have a vaccine for measles. So Nancy developed encephalitis, and as a result of that, she had to be hospitalized. She was very sick for quite a while. Fortunately, she survived, but she was left with intellectual disabilities that affected her for the rest of her life. This is a picture of Nancy at 6 years old when she was in first grade. It really took her a year to recover from the encephalitis, enough that she could go back to school. And of course, by then she was really quite far behind.
You're a retired nurse, and maybe say a little bit about how you see the public health arm of the nursing profession changing over time. I think you go back far enough so that this was a time when nurses visited people in their homes.
That's correct. So now, compared to what it was like when I first started nursing to now, it's like night and day. There was public health nurses. We went out to the families' homes. We really were able to develop a close relationship, and there was a lot of trust. And also back when I started nursing, even just a little bit before then, there was really only one news source. It was like CBS News, NBC News, ABC News, those three major anchors. Medical health news, health-related news did not come through your TV, and we didn't have the internet. So now our parents today, they have to sort through so much information. And I think a lot of the problem is that they're confused. They don't know who to turn to, just like the last guest talked about.
Yeah,
so that's one of the differences. The other big difference I really want to emphasize is back then our moms stayed at home, and now if a kid gets one of these diseases, we don't know what to do because there's no daycare that would accept a kid that with measles or pertussis or any of these communicable diseases. So that means that one of the parents is going to have to figure out how to stay home. And there's such a big economic crisis right now in the country that's really going to present another hardship. So that's another big difference.
You and I remember what it was like when polio vaccines were fairly new. And they were fairly new at a time when you probably would have a direct experience of somebody you knew who was a polio survivor, or maybe you knew somebody in somebody else's family who died from polio. And I think for that reason, there wasn't a whole lot of hesitation. I mean, if you were familiar with what polio could do, or measles, or any of these things, you're going to run to the doctor and get the vaccination. I feel like your organization is a way of dealing with the fact that we're almost victims of our own success. We've done so well at eradicating or pushing down these diseases that people don't take them as seriously as they used to, and they're in no particular rush to get a shot.
That's absolutely correct. Like when that vaccine for polio became available, there was such joy and jubilation, and our parents just lined us up as fast as they could. And in fact, there were 1.8 million polio pioneers. I mean, the parents literally threw their children at the science to make sure that we got a safe and effective vaccine. And it is quite different now. And that's what part of our story as grandparents that we really want to share is this hope and this optimism that if we can share our story without blaming, without telling our kids what to do, without advising them. And that's part of the problem too, is I loved your last speaker and having a group and having these one-on-one conversations so that we hear others' opinions. But one of the things that I've learned in nursing over the years is the very first thing that you need to do, regardless of the situation, is just to listen. Listen. It's the best thing that you can do to demonstrate that you care. And grandparents really do care about their kids, about their families, and we are the trusted messenger. So we have a chance to really make an impact. And if your listeners have a story, we encourage them, go to grandparentsforvaccine.org, share your stories. We're collecting them, and we have a YouTube channel that you can watch many of them at.
Yeah, the YouTubes are great. I'm sorry we don't have time for more, but Terry Mills, what a wonderful job you're doing. Retired nurse educator, grandmother, and board member and vice president of media for Grandparents for Vaccines. I particularly like the point about not blaming, too, which we all have a little bit of a tendency to do. All right, we have to go. That's all we have time for. I hope this meant something to you.
Baby, Grandma, understand that you really love that man. Put yourself in Jesus' hands, Grandma's hands. Grandma's hand used to hand me a piece of candy. Grandma's hand pick me up each time I fell. Grandma's hand, boy, they really came in a handy. She'd say, Matty, don't you whip that boy. What you wanna spank him for? He didn't drop no apple core, but I don't have Grandma anymore. If I get to heaven, I'll